Hi everyone, my name is Ronak, and the question I'm going to be answering is should we require labeling of genetically modified foods? My answer to this question is that yes, labeling should be required for genetically modified foods. To start off, GMOs have not been researched enough to decide if they are good or bad for the human body, environment, and the animals. Most studies have either come back negative or not enough research has been done. GMOs also have not been around for too long for scientists to study. Genetic modification works by crossbreeding special plants with the most desirable characteristics, such as disease resistance, high yield, good meat quality, larger product and mass, and tastier plants. For example, some plants may have a gene embedded into them that requires less water in order to be suitable for changing climates. According to OneGreenPlanet.org, Colin O'Neill explained that over 64 other countries around the world currently require labeling of GMO products. Some of these countries are all of the nations in the European Union, Russia, Japan, China, Brazil, South Korea, Australia, and many more. The biotech industry has been able to produce an astounding amount of organisms that are not produced by nature, such as potatoes with bacteria genes, super pigs with human growth genes, fish with cattle growth genes, and tomatoes with flounder genes. According to Center for Food Safety, as of February 2020, 92% of corn produced in the United States was genetically modified, along with 94% of soybeans and 94% of cotton. Other common ingredients that are often genetically modified are bread, cereal, soda, crackers, condiments, and many more. Around 80 to 85% of our processed and frozen foods are genetically engineered of some sort. The Federal Food, Drug, and Cosmetic Act was a set of laws passed by Congress in 1938, giving authority to the Food and Drug Administration, FDA, to manage the safety of foods, drugs, medical devices, and cosmetics. The United States' approach to regulating GMOs is towards regulating the nature of the products rather than the process of making the product. The FDA strongly encourages companies that develop new plant varieties intended for food use, including GMOs, to consult with the FDA first in order to assure that the food safety and regulations issues are resolved prior to selling commercially. This process is meant for the FDA to determine if regulatory action is needed with respect to food derived from the new variety, such as significantly increased levels of plant toxicants or anti-nutrients, reduction of important nutrients, new allergens, or the presence in the food of an unimproved food additive. The FDA currently does not require labeling of GMO products because they are not quote unquote materially different from other products. The FDA only requires labeling if you can smell, taste, or see the ingredient and chemical, but genetically engineered products are done through genetic molecular changes. The main reason why labeling should be required is simply because consumers have the right to know what they are putting inside of their bodies and what is in the food they eat. For example, alcohol and high fructose corn syrup have health effects, which is why they have labelings on them. This at least gives consumers an option and the responsibility to choose the products on their own. Many scientists say there is no testing shown behind the pros and cons of genetically modified foods. The idea of GMOs is still new in the bioengineering industry, which is why there is not much information about if they are safe to eat or what harm they can do, besides the chemicals. Food is an everyday necessity that everyone needs in order to survive, and it should be safe. Another reason why genetically modified foods should be labeled is because it helps vegetarians, vegans, and certain religions. According to tracegrains.com, Dennis Story explains that labeling these genetically modified foods can help vegetarians, vegans, and individuals practicing certain religions to easily determine if certain products have been modified. An example of a religion is the Protestant Church. King Bartlett, a national associate for the Presbyterian Hunger Program, explained that, I quote, I think most of that comes out of concern for those living in the margins of society, folks who are oppressed, impoverished, and hungry. He explains that many of these individuals live in agricultural areas and that how farming is done in those regions is critical to their health and survival. Another major concern with genetically modified foods is that it can be harmful to the human body. There have been some studies that have shown harm caused by GMOs. To allow the American population to consume these products, the sickest population in the developed world, which also has the highest healthcare costs, is extraordinarily contrary to the government to create a successful nation. The United States government should take this into consideration and also that this country has a high homeless population and these products can deteriorate their health even more. A contributor to diabetes is glyphosate, which is also sprayed on GMOs and is able to destroy the body's ability to make serotonin, which is able to regulate insulin. Furthermore, researchers have also found that glyphosate, atrazine, and many other chemicals destroy the gut bacteria where the majority of the immune system lies. This can cause liver and kidney damage, organ failure, destroy the stomach lining, and cause cell death and breast cancer cell growth. Researchers have found that atrazine contributes to the feminization of male frogs and reduced sperm count in men. Because of the many health risks for atrazine, the European Union has banned this pesticide in agriculture. Studies have also shown that frequent exposure to glyphosate doubles a person's risk of developing a blood cancer known as non-Hodgkin lymphoma. Many companies have been successful in marketing the potent weed killer glyphosate by saying that it is a way to replace other more toxic weed killers such as atrazine. Since the mid-1990s, American farmers have been able to reduce the amount of atrazine spread by just 22%, where it was where they used 0.83 to 0.64 pounds per acre. At the same time, there have been increased uses of glyphosate by 3,000%. It went from 0.03 pounds per acre to just more than 1 pound per acre, which is a big increase. The U.S. Environmental and Protection Agency has also warned about the use of atrazine because it has shown that it threatens wildlife. Also, the European Union banned it from its agriculture because of its health hazards and its persistence in groundwater. And an example is also that several studies have shown that frequent exposure to glyphosate doubles a person's risk of developing a blood cancer known as non-Hodgkin lymphoma. And a couple years ago, the World Health Organization classified glyphosate as a probable human carcinogen. And that is my presentation. Thank you. Mhm.